CHRISTUS Health, a Catholic healthcare ministry, is grounded in the conviction that each person possesses intrinsic worth by virtue of his or her existence as a human being, made in the image and likeness of God. Therefore, every decision made should promote and defend the human dignity of those we are called to serve. The care that is provided at CHRISTUS Health should be characterized by treating the whole person, since each person is an inseparable unity of body, mind, and spirit. In every interaction with our patients and residents, it is imperative that we provide integrative, compassionate care, attending to the physical, psychological, social, and spiritual dimensions of each person's existence. For care providers at CHRISTUS Health, treating holistically is an essential component of caring for our patients' body, mind, and spirit, and respecting their human dignity. The medical expertise offered through Catholic healthcare is combined with other forms of care to promote health and relieve human suffering.
Holistic care essentially means that we're not caring necessarily for a disease process, but we're caring for the patient integrally in every part of their lives. And that would be spiritual care, emotional care, and physical care as well.
Catholic healthcare should distinguish itself by focusing on the social conditions that contribute to and exacerbate illness.
Many things go into why patients are sick, and it's not always physical. It's their emotional well-being, their mental well-being, their home situation. And so if you don't have adequate food at home to take care of yourself, you don't get better. And so we have to take into account everything that affects that patient and make sure that we try as best we can to provide those things so that they can do the best that they can.
In a Catholic health system, holistic care is important because we want to encompass the mind, body, and spirit. Nursing is the most trusted profession out there, and so patients feel comfortable confiding in us and talking to us. So we don't only meet their medical needs, but we also meet their spiritual needs, and that involves bringing a chaplain in for their spiritual needs and bringing in additional resources as needed to address their behavioral health needs and their medical needs.
I see everybody working together. I see the physicians, the nurses, the therapists, the chaplains, all working together for the benefit of the patient.
For the patient, clearly, it's pretty obvious that it's beneficial to them because they come away from, typically come away from their encounters with providers and with hospital staff, feeling as if they've been listened to, feeling as if they've been cared for, and they're not just a number or a medical record to the providers and to the staff. They're actually a complete person.
The critical thing in holistic care is to really find out from the patient what is the most important thing to them in this stay.
Jesus' healing mission went further than caring only for physical affliction. He touched people at the deepest level of their existence. He sought their physical, spiritual, and mental healing. He came that they might have life and have it more abundantly.
With patients, we have to take an extra moment to listen to their needs. And a patient may have a problem that is actually outside of what we would consider normal medical practice. And by listening to the patient and understanding what their particular needs are for that day, we can seek out the resources that are necessary. In so doing, it's important that I have excellent relationships with my colleagues. And those good relationships will impart trust that I'm referring patients for the right reasons in a timely fashion.
If you talk with your patient, not just go in and check their vitals or examine them, but talk with them, they'll tell you things. And so they might not be trying to tell you that they don't have a winter coat, but something in what they say will tell you that. We also enlist our case managers to look at their background and to talk with them as well. And once we find a need, we will reach out to whatever discipline is necessary.
The most recent nursing data that's published through American Psychiatric Nurses Association, American Nurses Association, data shows that patient satisfaction scores improve tremendously when you encompass all aspects of their care versus focusing on one issue. In addition to improving their stay, you also reduce repeat visits and repeat utilization of services in the hospital by addressing all the needs.
One particular patient comes to mind. She's a lovely lady that I met in the hospital that had respiratory failure, and she had spent the last several years caring for her elderly parents, and in so doing was not taking great care of herself. And so once her parents passed, she became very depressed. She was smoking a lot and had been doing so for many years. We worked on preventative care with smoking cessation. We did medical things to optimize her lung function, and we worked on the spiritual aspects of the void that she was feeling after losing her parents. And to this day, I see the patient in rehabilitation where she's strengthening her body and her lungs, and she meets me with a smile every time I see her, so I think of her often.
Providing holistic care requires that we take an interdisciplinary approach to healing, providing safe, effective care through empathetic relations and coordinated, efficient processes to care for the whole person. Caring for the whole person is not limited to treating a disease or bodily ailment, but embraces the physical, psychological, social, and spiritual dimensions of the human person. Please consider all dimensions of your patients' lives and make referrals to the appropriate discipline to address the total needs of those we serve.